The number of active cases of COVID-19 in Western Australia has surpassed 20,000 for the first time, after the state recorded 5,005 new infections overnight. Key points. 3 WA COVID-19 patients are in intensive care in hospital. 3 WA COVID-19 patients are in intensive care in hospital. Just over half of the new cases were detected by PCR tests. Just over half of the new cases were detected by PCR tests. The BA.2 strain is believed to account for about a quarter of Omicron cases. The number of people in hospital also continues to rise, with 92 people now being treated. 3 people are in ICU, the same number as yesterday. The latest positive results were split between 2,866 PCR tests and 2,139 self-reported rapid antigen tests. A total of 14,090 PCR swabs were taken yesterday. There are a total of 20,788 active cases in WA, with the number of cases recorded since the beginning of the pandemic now approaching 40,000. ICU numbers better than expected so far, AMA. The Australian Medical Association's WA President, Mark Duncan-Smith, said those numbers, and particularly the number in intensive care, seemed far lower than predicted. We would have expected about 20 people to be in the intensive care unit, he said. This most likely reflects the fact that WA has such high vaccination rates, and therefore such high protection against severe disease. But he called on the government to release its modelling to show exactly how the current situation compares to what was forecast. Without that, Dr. Duncan-Smith said it was impossible to know whether cases would still peak at around 10,000, which the hospital system could cope with. No one knows where we are because only the government has their top secret modelling, he said. No one else can make comment, which is part of the power game of the government, because knowledge is power and they are the only ones with the knowledge. Dr. Duncan-Smith also said it was likely COVID boosters would be required each year, possibly with the flu jab, as the virus continued to mutate. WA not hugely concerned by Omicron BA.2 subvariant. Health authorities believe the BA.2 subvariant accounts for about a quarter of Omicron cases in WA. The New South Wales government fears cases there could more than double in 6 weeks due to the subvariant. But WA Health Minister Amber-Jade Sanderson yesterday played down its likely impact in the West. Amber-Jade Sanderson says BA.2 is slightly more transmissible, but no more severe. We're not hugely concerned that BA.2 is going to derail our COVID response, if you like, or see any major increase in cases. My understanding is that it's slightly more transmissible, it's not more severe, she said. WA is expected to reach its peak number of daily infections on Monday, with modelling suggesting about 10,000 people will test positive then. With the variant still relatively new, Kirby Institute virologist Stuart Turville told ABC Radio Perth it was difficult to completely understand its impact. It's great to model and predict things, but I think what we learnt from when Omicron popped up is we had all this really beautiful modelling that encapsulated Delta, and then Omicron turned up and it basically cleaned the slate, he said. BA.2 isn't as big a jump as, say, Delta to Omicron, but it's something we'll find out over time. Premier's self-imposed isolation, a childish stunt. Premier Mark McGowan remains in self-imposed isolation after returning from Sydney earlier this week, where he gave evidence as part of a defamation case launched by businessman Clive Palmer. He left isolation today to attend National Cabinet at Dumas House because a secure link could not be established to his hotel room. It led to Liberal leader David Honey again questioning why the Premier had chosen to place himself in isolation, labelling it a childish stunt. What's he avoiding? Dr. Honey asked. David Honey again questions the Premier's decision to self-isolate. He doesn't have to do it, his Attorney General isn't doing it. Does he want to avoid scrutiny from the media? Mr. McGowan previously said the decision was in part about avoiding the perception he had opened WA's borders earlier this month to avoid the need to quarantine. Ms. Sanderson said yesterday, it was also to reduce the risk of passing COVID to cabinet colleagues and those involved in managing the pandemic. Local councils forced to hold vaccine mandate meetings. It comes as WA councils grapple with the legal obligation to hold community meetings on vaccine mandates because of requests by small groups in the community. The City of Joondalup held a special electors meeting on the topic last night, with Fremantle among those following suit next week. Under the Local Government Act, such meetings must be held when at least 100 electors request them. It's frustrating because it's just not a local government issue, Fremantle Mayor Hannah Fitzharding told ABC Radio Perth. Fremantle Mayor Hannah Fitzharding said vaccine mandates were not a local government issue. I don't think anyone would be looking to next week to organise an event of up to 500 people, but we're obliged to under the Act. Mayor Fitzharding said she was worried many who would attend on Monday have mask exemptions and were unvaccinated. My concern is our staff have to be right in the middle of that, and I feel very uncomfortable, she said. At its January meeting, the Fremantle Council voted in favour of not advocating against the mandatory vaccination policy. Hundreds of ratepayers also forced the City of Busselton to consider their calls for the abolishment of COVID-19 mandates in an electors' meeting held last month. Calls for meeting requirement to be waived. The president of the WA Local Government Association, Karen Chappell, said she shared many of Mayor Fitzharding's concerns about holding a public meeting at the moment. Ms. Chappell, who is also the president of the Shire of Marawa, told ABC Radio Perth the association had been advocating to the state government for the requirement to hold such meetings to be waived. It's not about the subject of the meeting, it's about the numbers of people that we're expected to hold a meeting for, Ms. Chappell said. Marawa Shire President Karen Chappell said she was also frustrated about holding the meeting. She also voiced her frustration at councils being asked to intervene in a topic they have no control over. But Diane, who told ABC Radio Perth she was part of a group helping push for similar meetings across the state, said they were about asking councils to represent their residents. It's not anti-vax at all, it's a right of advocacy for their electors, she said. Local Government Minister John Carey said some electors could be misusing powers under the Act, which are under review. There are currently a number of measures related to meetings under consideration as part of local government reform, including for special electors meetings, he said. It is critical that these measures ensure ratepayers continue to have a right to raise important community issues. John Carey accused the organisers of the meetings of hijacking the process to pursue an anti-vaccination agenda. Notwithstanding that, in some cases it does appear that the provision has been misused by people with an anti-vaccine agenda. Mr. Carey said his department had provided advice to local government on the issue and was available to help councils facilitate meetings in a COVID-safe manner. COVID breaks out at youth prison. There has been an outbreak of COVID-19 at the Banksia Hill Juvenile Detention Centre, with 2 detainees and 7 staff testing positive to the virus. Commissioner for Corrective Services Mike Reynolds said the 2 young people were positive when they arrived at the jail. Banksia Hill Juvenile Detention Centre was prepared for an outbreak, Commissioner for Corrective Services Mike Reynolds said. Infection in the centre is to be expected given the very high caseload we are currently experiencing in the community, Commissioner Reynolds said. We are well prepared to manage infectious diseases and have particular measures in place to reduce the impact of COVID-19. The 2 detainees are being held in a dedicated area, and the Department of Justice said they were asymptomatic and had not mixed with other detainees. The department said they would continue to be able to contact loved ones, caseworkers and lawyers, as well as make court appearances. The 7 staff members who tested positive were isolating at home until they are no longer infectious. Loading.